Hey there, my name is Casey Greene. I am a PharmD and certified functional medicine practitioner and a clinical liaison of integrative medicine with Revelation Pharma. Today we're going to cover minerals in IV nutrition. So quick disclaimer, contents on this video are for educational purposes only and do not constitute as medical advice. Content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Please always seek the advice of a doctor, pharmacist, or other qualified healthcare provider with any questions in your specific situation you may have. Never disregard professional medical advice or delay in seeking if you have any questions, and always call 911 in an emergency. So what we'll cover today. So what are minerals? What are the salt forms and the differences of those minerals? Looking at dosing in milligrams versus milliequivalents, since that can be a big point of confusion. And then we're going to meet all different core minerals that we'll go over. So mechanism of action, benefits, protocol and dosing, as well as side effects and precautions. And then just some overall helpful tips when doing IV drips with minerals. So what are minerals? They're just simply naturally occurring inorganic nutrients that are essential to proper bodily function. They have to be ingested through the diet or other means, and they're typically in soil, fruits, vegetables, many parts of the diet, or in rock formations. So the different salt forms and what are their differences? So everyone of course knows of the different minerals like calcium, magnesium, potassium, but they can be attached to different things that makes them go into solution different ways, do different functions, or travel through the body in different various ways. So that's what I'm referring to here. So the charges, positive and negative, they keep the compounds spread throughout the solution. So for example, magnesium chloride is a magnesium with a 2+ charge paired with 2 chloride. So with mag chloride, that would be how the positive negative charges keep it separated out in solution. Another example would be like magnesium sulfate, for example. So that's another way that you have a pairing that breaks up in solution, so an IV injectable, into these positive and negative charges. And different salt forms, whether it's chloride, sulfate, or other salt forms attached to magnesium or calcium or whichever mineral we're referring to, they're going to have these different charges and have some different ways that they react in solution and potentially in the body as well. So as I said, minerals can be bound to various salts. So sulfate and chloride are very common ones, and most of our minerals will be bound to chloride, and that's for the sake of, say it goes into a solution of normal saline, so sodium chloride 0.9%, then that the sodium and the chloride can interact with the chloride in this mixture here, whereas sometimes we might use sulfate because it's either what's indicated for something, or it just that form tends to be more soluble or stable. But then there's also the weights of the salts that differ. So chloride has a lower molecular weight than sulfate. So if looking at mag chloride versus mag sulfate, the mag chloride milligram for milligram would have more elemental magnesium per milligram compared to magnesium sulfate. So that's something to additionally factor in on top of how many milligrams per ml is this solution. So here are some examples here, and it's worth noting that, again, like I was just saying, magnesium chloride might come in 150 milligrams per ml, which is 15%, and then magnesium sulfate frequently comes in 500 milligrams per ml, or 50%. So that's another factor on top of the different molecular weights. And even if they were milligram for milligram per ml, the molecular weights would still make up for a difference in the amount of elemental magnesium or the milliequivalents of activity per milligram. So all of this has to be factored into the dosing when it comes to minerals. So there are FDA indications that are usually specific to a particular salt. An indication might be only specifically, as far as the FDA is concerned, for magnesium sulfate, for example. That doesn't mean that other salts can't potentially be used off-label for the same benefit, but it has to be done so with considerations. So, when bound to different salts, may or may not cross over different parts of the body as well. It may have different solubilities in solution, and it would have to be adjusted to account for those different molecular weights or different concentrations in milligram per ml or milliequivalents, all these different factors. So, and it is notable that some salts deliver to various parts of the body better than others, such as crossing the blood-brain barrier, although most of the salt forms used in IV solutions will have similar with 100% bioavailability. So more often in those, not always, but more often, we're more worried about just making sure we want to adjust for the milligrams per ml, but then also the salt form and the molecular weights on that, so the actual milliequivalent activity in the body. So here's just some various salt forms that you might see. Some not as much in IV, but in different formulations. Some might be oral, but chloride, sulfate, sodium, gluconate, carbonate, citrate, glycinate, selenite, chelates, nitrates, phosphate, acetate, orotate, threonate. Threonate's an example of one that crosses the blood-brain barrier better, but is typically only in oral formulations. But just to give you an idea of different salt forms that are available and how they could have different solubilities, make the ultimate concentration of the elemental part, the magnesium, calcium, etc., different, and how they might have somewhat different ways of delivering things inside the body as well. So now dosing in milligrams versus milliequivalents, as a lot of the same things for potassium, for example, is often referred to in one or the other. So you want to make sure not to mix those up because they're very different as far as the numbers that we're discussing. So milligram or mg is just a weight-based measure. I guess you could say simpler in a sense, and the most common measure in most injectable formulations. And then we've got milliequivalents, which is more of an electrolyte-based measure. So it's actually the chemical activity relative to activity of 1 milligram of hydrogen. So it has more to do with the chemical activity in solution versus just the pure, simple weight-based measure. So just know which one you're dosing in and how to adjust. So here you can see some equations that can convert between one or the other. So if you wanted the milligrams per ml and you only had the milliequivalents, you could look up the molecular weight and the valence of a given compound, whether it's calcium chloride, magnesium chloride, whatever you have, and you can use sources such as PubChem to find the molecular weight and valence that you can plug into these formulas if you had to convert back and forth. And then you can see here innovation compoundings, salt and milliequivalent conversions. So it makes it kind of easy to see back and forth between weights to milliequivalents, and then even looking at different forms like calcium chloride versus calcium gluconate, and how much elemental calcium or magnesium or potassium they actually have per formula, and how you might go back and forth between the two, because they would not necessarily be dosed ml per ml equivalently. So you have to look at these different types of conversions here, and this reference is again available with innovation compounding. So now we're going to meet the minerals. So your individual choices, the most common ones, will go into a bit deeper with the mechanism of action, the benefits, protocols and dosing, side effects and precautions that you most need to look out for. And then, as we stated before, remember just to distinguish between the different salt forms that you might be using, because they can have different concentrations. And then milligram versus milliequivalent dosing. What kind of dosing are you referencing? Is it the purely weight-based milligram, or are we looking at activity and solution with milliequivalents? So just be aware of those. So calcium. So mechanism of action. So as everyone largely knows, calcium salts make up most of the bone mass at 60 to 70%, and calcium produces the excitatory activation of our nervous system, our musculature, so contracting our muscles, as well as contraction and activity in all of our organs and many other activities. But that's some of the most common major things that we think of with calcium. So then benefits naturally with having healthy calcium levels. bone strength, nervous system function, muscle function, and much, much more. So calcium, of course, a critical element and mineral for health. And now some common protocols and dosing. So with calcium chloride, 100 milligram per ml injectable, it's common to see 1 to 5 mLs in a slow IV drip in combination with other vitamins and minerals, whether that's a Myers cocktail or whatever kind of custom mixture that you might have. And then sometimes 5 to 10 mLs in more select cases, but that's more often in 10 mLs, for example, in like emergency situations. So I generally don't recommend up to the 10 mLs in just standard outpatient supplementary type of protocols, because in that range you will see increased risk of side effects, and that's where we really, we always want lab monitoring, but that's where lab monitoring is highly recommended when we get into the higher doses. So then side effects and precautions, potential side effects, muscle contractions, nerve sensation, hypotension, bradycardia, arrhythmia, tingling, syncope, and cardiac arrest in extreme situations. Most of those would be, and with all of these minerals, I'll go ahead and say this is typically with higher dosing, or higher dosing that's pushed or delivered too quickly is when you're more likely to see these types of side effects, but these can occur. So even though these minerals are a normal, natural part of our day-to-day diet, in these IV injectable forms, they become very powerful on a pharmaceutical level. And many of these are used even in acute care situations in hospitals and things like that. So they begin to have very strong and higher level effects when we use IV dosing and in these higher amounts. So just be aware of that, and that's when these potential side effects more so come into play. Because even though we absolutely have to have these minerals in our diet, it is also dangerous to super supplement them at high levels, and it's easier to do that with IV infusions, so we just have to be very aware. So calcium, notably, is typically dosed at less than half the amount of magnesium for electrolyte balance purposes when we're doing these IV nutrient bags. You'll always want to check the bag for precipitates, especially if you're mixing calcium with something with a phosphate salt involved, because calcium and phosphate will tend to bind. But there are other salts that calcium could potentially form as well. So you just want to make sure that you check for those precipitates, especially if you're using higher concentrations of various different salts. And notably, calcium is IV only because intramuscular brings too much risk for local tissue necrosis. Then we've got magnesium. So magnesium is, out of all of these, probably what people are most commonly deficient in. So in my opinion, supplementing magnesium can have some of the greatest benefits to many different parts of the body very quickly. So some of the mechanisms of action: enzymatic activation, it's a calcium antagonist, because as I mentioned before, we kind of want calcium and magnesium to work in concert with one another. Whereas calcium is more the activator and excitatory side, magnesium is more the relaxatory side. So muscle relaxation, as well as nervous system stabilization, and somewhat the relaxation side of it. It's involved in ATP generation, so even though it's involved in relaxation, it does help the body to efficiently generate energy. It's involved in DNA and RNA synthesis, blood vessel relaxation, so being magnesium deficient can be part of having hypertension. It's a large part of bone structure as well, in addition to calcium, and many, many more things. Magnesium does hundreds of things in the body. Way too much to cover here, but those are some of the highlights. So then the benefits you can get to your actual health. So for anxiety, for help with sleep, energy, mood, cardiovascular health, blood sugar optimization, blood pressure, bone health, it's anti-inflammatory, it supports electrolyte balance, it supports sexual health, it's been used to treat migraines and many other things, because again, magnesium does hundreds of things in the body, and it is probably the mineral that the most people are deficient in and can get benefit from right off the bat. So some common protocols and dosing. So with magnesium chloride, 150 milligram per ml injectable, we would commonly see up to 8 mLs in a nutritional IV drip, especially if given in less than 2 hours. which is the most common type of scenario. And then in more rare scenarios, where large infusions are done over a period of greater than 4 hours, you might use up to 16 mLs. But again, that's more rare. It depends on the time being given, because just like with calcium, most of the side effects are going to occur if magnesium is given too much and or too fast. So the potential side effects: flushing, headache, hypotension, lightheadedness, nausea and vomiting, and eventually fainting. And again, those kind of happen almost in sequence, and more likely if too much is given or it's given too fast. So as long as you stay within those dosing parameters, less than 8 mLs, and don't give it too quickly, a slow drip over an hour or two, you're typically not going to see those kind of side effects. But you do want to monitor patients, because flushing and hypotension, headache, and maybe some nausea would be kind of the first things to onset if it is a little bit dosed too quickly for them or too much. Then we got potassium. So potassium, just like the others, involved in tons of functions in the body. So some of the mechanisms of action: electrolyte balance, of course, nervous system transmission, muscle contraction, fluid balance, sodium counterbalance, acid-base balance, heart contraction, blood pressure regulation, energy metabolism, red blood cell function, and many more functions of potassium in the body. So based on that, some of the benefits, some of the health benefits are blood pressure control and cardiovascular overall support, bone health once again, electrolyte balance and optimal muscle performance, metabolic and blood sugar health, many benefits to potassium. And some common protocols in dosing. So with potassium chloride, 150 milligram per ml, for example, which notably is 2 milliequivalents per ml. And I like to note that because commonly in literature and protocols, milliequivalents are the noted dosing of potassium. So we just like to know which one we're referencing so that we can dose appropriately. So 1 to 8 mLs as a IV as part of a slow drip combo is most often what we would see in outpatient settings. But I do recommend typically to avoid casual IV supplementation in an outpatient setting without lab monitoring, and think of potassium as more of a mineral balance improvement, and not trying to really use an IV in an outpatient, especially not with labs monitored, simply for potassium repletion. We more so want to use it in an outpatient setting when we're thinking like electrolyte pre-correction, for example, with high dose vitamin C, because of the driving effects it has on insulin and driving minerals into the cells, which can lower the blood serum levels of things. That's when potassium comes in to help balance and pre-correct that out, along with the other required minerals. Or a D5W carrier solution, for example, which will spike insulin levels. And therefore, in those kind of protocols, sometimes potassium can be helpful to include because it pre-corrects and keeps that electrolyte balance in place. But to just carelessly supplement it via IV in an outpatient setting without monitoring labs, I would consider that more on the careless side and probably not recommend it in most situations. So side effects and precautions. Potassium can be very safe when used appropriately, but it can also have very bad adverse events if used inappropriately, hence the previous things that I said. So potential side effects: vein irritation, phlebitis, tissue necrosis, hyperkalemia, and even arrhythmia and other cardiac complications that can be very severe if done improperly. So that's why I say lab monitoring can be so important. And generally in nutritional supplementation protocols outpatient, I would only use it with things like high-dose vitamin C or other insulin-affecting drips and things like that. So it's never to be given intramuscular or slow IV push due to potential damage to the local area or vein. So it's slow IV drip only, and it has to be diluted. Now zinc. So some of the mechanisms of action for zinc: it's an enzyme, cofactor, antioxidant, immune system optimization. Most healthcare providers have heard of the immune boosting benefits of zinc, and it's one of the most proven things, potentially even at reducing the duration of the common cold in certain dosage forms and doses. It's involved in DNA and protein synthesis, and once again, many more things, far more than we can cover here in this brief presentation. But some of the core benefits to zinc: Immune support, of course, hormone optimization, sexual function, blood sugar and insulin sensitivity, skin, acne, and wound support, antioxidant support, and all sorts of brain, mood, and neurological support, anti-inflammatory, and it's even been studied and shown to have strong support in vision and eye health as well. So some common protocols and dosing, typically in the lower range, so 0.5 to 2 mLs IV and some sort of combo drip, and very good to add to almost any immune drip protocol, assuming it's compatible with everything in there. So potential side effects and precautions, they are rare with normal dosing, but with high dosing or prolonged high dosing, what you would probably first see is something like altered taste, like a metallic taste, and then headache, diarrhea, nausea, vomiting. And notably, it can cause copper depletion or iron depletion, like once again, more so with higher dosing or longer term high dosing, but that's just something to look out for if you're monitoring these different mineral labs to assess status. And this one is IV with dilution only as well. IM's not recommended just due to local tissue irritation due to the acidity. And since zinc is mostly renally excreted, do use caution with severe kidney disease when supplementing zinc via IV. So now manganese. And I want to go ahead and state, and I think it's in the next slide as well, but just always make sure to not confuse manganese with magnesium, because that is a common potential mix-up when looking at these different minerals. So with manganese, the mechanism of action, or a few of them, so once again, enzyme cofactor, antioxidant activity, neurotransmitter regulation, nutrient metabolism, bone and cartilage formation, blood clotting, and many, many more. So a few of the core benefits of manganese: immune support, bone support, antioxidant, metabolism, neuro support, and many others. So some frequent dosing. So manganese is a trace element. So with manganese sulfate, 0.1 milligram per ml, you would commonly see anywhere from 1 to 8 mLs IV as part of a combo drip, and more often in the lower range, like 1 to 5 mLs, but sometimes up to 8 mLs in certain protocols or if deficiency were seen. And then side effects and precautions, once again, very rare with normal dosing range, but with toxicity levels, you could get neurological symptoms, GI symptoms, and impaired iron absorption. So once again, don't confuse manganese with magnesium. Dosing is very different. There is caution with cholestasis because it is excreted through the bile, and caution with anemia due to that potential impaired iron absorption. So now selenium. So selenium, very helpful element here in mineral. So antioxidant, it's critical in converting T4 to T3 with the thyroid process. It's a blood sugar regulator, immune cell function, and antibody production, as well as separate antiviral activity, helping inhibit viral replication, DNA synthesis and repair, sperm production, and other sexual health benefits, vision benefits, and many more. So overall, thyroid, metabolic, blood sugar support, immune support, antioxidant, sexual reproductive function, cognitive support, joint support, vision. So you can probably see at this point that a lot of these minerals have so many functions in the body that they're just absolutely necessary. It's hard to even pin down to just a single benefit, but you certainly could select one of these if a patient were symptomatic for a certain thing, say sexual health. Selenium is actually a good one because a lot of times patients are deficient there. So thyroid or sexual health, additional supplementation of selenium could be beneficial. So protocols and dosing. Selenium, again, a trace mineral, so we're talking low doses here. So 1 milligram per ml injectable, but typically you wouldn't even give an entire ml. So 0.2 to 0.8 mLs in most combo IV drips, and probably more often in the 0.2 to 0.5 range, honestly. Side effects and precautions, yet again, rare in normal doses and more likely at toxic doses. But you could see diarrhea, nausea and vomiting, selenosis, which includes GI disturbance, hair loss, blotchy nails, garlic breath, some pretty nasty group of symptoms when you get into that really toxic level of selenium, fatigue, irritability, So just make sure to be very careful with the dosing of selenium, since it is typically in microgram dosing. You don't want to confuse it with the dosing of one of the other ingredients in your drip. So generally don't recommend in pregnancy, even though selenium is a required part of pregnancy and fetal development. Very high doses of selenium are not recommended in pregnancy, as excessive levels can possibly be more harmful than low levels. So selenium in a prenatal, in normal dosing, that's fine orally, but generally not high or excessive dosing, or risking excessive dosing with injectables, unless you really know what you're doing and have seen low levels specifically and are going to do very low dosing. And once again, caution in renal disease, as it's renally excreted. And then some other trace minerals that we won't have time to go very in depth in today, but chromium, copper, molybdenum, iron, sodium, lithium, iodine, fluoride, cobalt, vanadium, nickel, silicon, strontium, boron. So these are all required in trace amounts, even arguably lithium, but some are not as widely available for IV use. So we're not going to go really in depth into these today, but just note that they might be in commercial trace mineral blends, for example, and they are required in very small amounts, but they're just individually might not be used as often in the IV setting, but sometimes are, especially more on the TPN side in acute care. And now for just some general useful, helpful tips. So taurine is a great addition to many of these mineral drips, because minerals are also electrolytes. So remember these positive and negative charges. So taurine is the master electrolyte regulator, and very useful addition in many of these drips in the 1 to 5 ml range. So patients often report feeling better immediately with taurine, and you might have noticed it's actually in a lot of energy drinks for this very reason. But when giving these IV drips, it can really help enhance the electrolyte's ability to optimally cross those membranes and find electrolyte balance, because there's more than just putting the electrolytes in the system. There are other parts like taurine that actually help regulate getting them where they're supposed to go and finding balance. So for that reason, taurine can be a very useful addition and worth mentioning. You always want to pick the appropriate carrier fluids and bag sizes depending on what minerals you're using. If you're combining them with vitamins, what's the total osmolarity? So a lot of cases that might be normal saline or 0.9% sodium chloride, but in some cases it's not. So you want to make sure that you're looking at all the factors when you combine various minerals and ingredients together. Make sure it's soluble, that it's not salting out in solution, because again, remember, these are salts, and in the earth they're often in salt or rock formation. So they will form salts in solution if you're not careful with solubility and what's compatible with one another, or don't have the appropriate carriers. And as part of that, you'll want to check the final osmolarity to make sure that it's safe for administration to the patient. And just remember, more is not always better. So with all of these, the side effects most often happen when you have too much too fast. So you just want to dose appropriately, and more is not always better. So in summary, minerals and IV nutrition, we covered what are minerals, different salt forms and differences in those, different dosing metrics such as milligrams versus milliequivalents, and then meeting all of your major core minerals that are commonly used in IV nutrition, such as, and covering the mechanism of action, benefits, protocols and dosing, side effects, and precautions, and then some helpful tips such as potentially adding taurine to your drips, checking the osmolarity, and make sure you use the right carrier fluids. So that summarizes this presentation today. Here's how you can connect with us: sales@revcustomrx.com, or at 1-800-547-1399, or revcustomrx.com. And here you can see various places on social media that you connect with us, and some various pharmacies that are in our network across the nation. And once again, I'm Casey Greene, PharmD, clinical liaison of integrative medicine with Revelation Pharma. And please just feel free to reach out to us if you have any questions. We'd love to help out. Thanks.